One of the lingering questions that I get the most is about antibody testing and why, if our clinic has had antibody testing for the last 2-3 weeks, are we not promoting this, or are we not doing more of this? And is antibody testing actually useful? So if you can suffer through about 2 minutes of statistics, I think I can kind of answer the question. But basically, come on this side. So when we're talking about a test in general, you have your disease, and you have a test, and what we want to see is that you either have the disease or you don't. In the simplest scenarios, you either test positive for the disease or you don't. And so what we want to see is everybody that actually has the disease tests positive, and we pick that up. So nationwide, in the worst pockets and that kind of stuff, we're seeing maybe a 5% prevalence. So if I pull 100 people off the street randomly and test them, I should find that about 5 people that actually have COVID test positive for disease. In an ideal scenario, none of them are going to test negative. We pick all of them up. So that gives us a total of 5 tests. 5 out of 5 were positive for disease. So that's 100% on what's called the sensitivity of the test. So that's really, really good in an ideal scenario. The opposite of sensitivity is specificity. And if you have a test that's 100% sensitive, you almost can't have a test that's 100% specific. But what that means is that, again, if I have those 100 people, everybody who doesn't have the disease actually tests negative. And in the real world, we'll say maybe we can get 99 to test negative, and only 1 who doesn't have the disease accidentally tests positive. So that's called specificity. And so in this example, again, I tested a total of 100 people that don't have the disease. 99 were negative, so that's a 99% specificity. And as a physician, this is fantastic. This is what I want to see, because of all the people walking around, the ones that were actually sick, I tested them and I know about them, and we didn't miss anybody, no false negatives. Only 1 person doesn't have the disease and tested positive, which as a physician, fine. I'm going to keep an eye on them, but they're going to be the person that's like, oh yeah, I had COVID. It was just a bad cold. It was no big deal, because they didn't actually have it. But more importantly, I can rest easy at night knowing that I didn't send somebody home who actually had the disease and then is going to go home and have a complication from it. So these are what we like to see as providers treating patients. But when we're talking about antibody testing, you guys are more interested in what does this mean for me as a patient? How much can I trust a positive antibody result to tell me that I don't, or that I have antibodies to COVID and I'm not going to get this again? So for that, we're looking at something called the positive predictive value. You're not necessarily as interested in the disease, you're more interested in the test. So in this same kind of ideal scenario, we had a total of 6 people that tested positive for the disease. 5 out of those 6 people actually had COVID and now have antibodies and should be immune. So that's about 83%. Only 1 of those people, 1 out of 6, didn't have the disease but tested positive. So that's about 17%, which means in this scenario, 17%, that's close to 1 out of 5 people that I test, they come back with a positive test and say, hey, you have antibodies, you should be immune. 1 out of 5, 1 out of 6 of those was a false test. They have a 17% chance of now not wearing their mask, not socially isolating, and picking up the disease. And so when you hear like, oh, you have antibodies, but you can still get infected, that's probably a lot of these people that are having that kind of a complication. And so that's one reason that we're not recommending the antibody testing. But again, this was kind of an idealized scenario, right? So if we look at what's actually going on in Lander, in Fremont County, it actually gets a whole lot worse, because in Lander, and I just was discussing maybe a 2% prevalence, more like a 1% prevalence. So only 2 out of 100 people are actually testing positive for disease. And then, so this is test positive, negative, this is COVID. And then you also have to look at the true sensitivity and specificity of the tests. So the ones that we're using are all on the FDA approved short list of tests that are deemed accurate enough to use. And some of those actually get pretty darn close to having that 100% sensitivity. So we're not missing anybody that didn't have disease. But then when you look at the specificity, some of them can report up to as high as 99%, but it may be as low as 95%. So now when you look at the people that test negative, it's going to be 99 to 95 out of 100 people down here, and 1 to 5 out of 100 people up here. So now when you look at land in Wyoming and you do your same positive predictive value test to see how much can I trust this test and know that I'm immune, potentially you had 2 plus 1 is 3, 2 plus 5 is 7. You had anywhere from 3 to 7 people tested. At best, if we have a 99, then 1 out of 3 people had a false positive test. So 33% chance that I'm going to tell you you're immune to coronavirus when really it was a false positive and you can go out and get it. At worst, actually 5 out of 7 test or have a false positive, which now I can't do math in my head. I'm going to say that's roughly 60%. So if we combine this and take an average, you're looking at about 50% chance that even if you come through our clinic, get an antibody test and it's positive, it's only a coin flip that you're actually immune to coronavirus or that you've actually had this before. So for all the people walking around saying, I had the worst cold in March, I know I had coronavirus, test my antibodies, I want to prove that I had it. Even if I do that, even if I tested it, you can only trust that 50% of the time. And statistically, and what we're finding with the handful of people that we have done antibody testing on, is that you have a 99 to 95% chance of testing negative because we're only seeing a 1 to 2% prevalence in our community. So for that reason, there's not a lot of good information that people are getting because what they're wanting is to say, I'm immune. It's okay for me to go visit grandma. It's okay for me to go and see other people, but you only have a 50% chance of that being true if you test positive.
What's the chance of when someone tests negative then of it being true?
Awesome, love that question. So that's called the negative predictive value. And so that's the same thing. So that is actually really good because down here in this scenario, we'll take the worst case scenario. You had 95 people test negative, but nobody who had the disease tested negative. So you still have 95 out of 95 people testing negative. It's 100%. So that brings up one of the few people that actually do benefit from antibody testing. If you were convinced that you had the worst cold of your life in March or April and that you already had coronavirus, and you come in and get antibody testing and it proves, no you didn't, then you can actually trust that result. And so for some people, that actually motivates them to say, okay, I need to keep wearing a mask, I need to keep socially distancing, I need to keep doing those things. And so if that is your patient, or is that somebody that's coming to our clinic, or they're dragging in a spouse to say, my spouse isn't wearing their mask, you need to show them that they don't have antibodies. Okay, maybe antibody testing is positive, or is useful.
Positively negative.
Yeah, positively negative. Maybe it's useful. But for the vast majority of patients, for us in general, being healthcare workers, saying, oh, I've been exposed a lot, maybe I'm in that group. Even if you're positive, it's not a result that you can test or that you can trust. And so that's why we're not recommending it for the general public. That's why no, socially responsible lab or provider is going to say, yeah, come in and get your antibody testing, because they can't be assured of the results that you're giving, that they're giving you accurate information about your risk for getting coronavirus moving forward. And so, yeah, other than the people that want the reassurance that they don't have antibodies, there's not a lot of utility for it. One exception, especially in pediatrics that I deal with, is the multi-inflammatory system or syndrome in children that we're seeing. Positive antibody tests are kind of part of the criteria for making that diagnosis, and so in that instance it's helpful, but by and large it's not a helpful test right now because our overall prevalence is so low.